Okay, hi everyone. I think we're getting going. Let me check if we're popping up here.
Is it good?
I think we're good. Okay. Great. So thank you all for joining. I am really excited to be here doing our Facebook Live Q&A with I've heard from multiple people who know way more about this than me, that this is the world's foremost expert on what we're going through right now. So Professor Marc Lipsitch is a Boston resident, as well as a professor of epidemiology and the director of the Center for Communicable Disease Dynamics at the Chan School, Public Health School of Harvard. So Professor Lipsitch, thank you so much for spending time with us. I know you're getting hundreds of media requests all the time, and you've just made sure to share your expertise. Could you tell us a little bit, before COVID and this outbreak, what were you doing in your normal day-to-day life?
So we have a center at the Harvard Chan School of Public Health that studies various infectious diseases and how they transmit in populations, and everything from studying the genomes of the viruses and bacteria that transmit to modeling how they transmit and learning new ways to analyze the data. And we do a lot of work in sort of between outbreaks to try to get ready to be more effective in responding when we have an outbreak. Some of that is a little bit less exciting and certainly less intense than what we do now. But the point is to build up a reservoir of knowledge and technique so that we can be ready to respond. In the last 6 weeks, or 4 to 6 weeks, we've been very much focused on trying to respond to this outbreak, and about 18 of us or so working on it in various capacities.
Great. Well, shout out to you and your entire team. So you've been involved with the SARS and MERS and other recent outbreaks, as well as kind of studying and applying lessons from even way before that too, right?
That's right. Yeah. So when we got into this mostly through working on SARS in 2003, and then got interested in studying the lessons of 1918 back in the 2000s, when people were worried that bird flu would be the next pandemic. Fortunately, it wasn't, but we're finding ourselves in a weird position that we were studying flu, and now we have a different disease that's not flu, but there's still some lessons. So.
Yeah. And we first met because you had come out in support of the dim sum event that several colleagues on the City Council, Ed Flynn and City Council President Nina Liang and others from Boston, had organized, because right after the outbreak, internationally, we were starting to see that Chinatown businesses were hit really hard.
That's right.
So the community rallied when they realized there was this misinformation leading to discrimination and racism. And we had over 400 people with us celebrating Chinatown, rallying, and you were there that day. But my guess is that you wouldn't support people putting together a 400-person event today.
That's right.
What's changed?
That's right. I think at that point, we didn't know where the virus was exactly, but we knew that it was very, very rare in the United States at that point, and that stigmatizing a whole group of people because they come from a place where a seventh of the world's people come from is not a sensible way to respond. And so I came for that reason. Right now, we're really in a different phase where there seems to be ongoing community level transmission, much of it not observed because we don't have enough testing kits. And that's probably not only true in Boston, but in many areas across the country, and certainly across the world. So at this point, it's very important to start slowing the transmission of the virus for a variety of reasons.
So and I'm going to keep looking over to the side because I have my laptop set up here, so if folks are asking questions live, I'll try to keep track. But we did get a lot of questions through Twitter, Instagram, and on Facebook. Many of them were about the virus itself, kind of how contagious it is. What do we know about COVID-19? And could you just tell us a little bit about how we should understand the virus?
Sure. So we know that it emerged sometime early in December or maybe late November in Wuhan, China, probably tied to an animal market. And it was recognized fairly soon after that people could transmit it to each other. It wasn't just tied to the market. And people began to get worried as that happened more and more. And it has now spread through travelers from Wuhan to the rest of China, and from the rest of China and Wuhan itself to probably almost every country in the world, although it's only been detected in a fraction of those countries. Still, there are dozens of countries infected that know about it, and some others that don't. We know that it is contagious between people at a level probably pretty comparable to pandemic flu. It has what we call a basic reproductive number around 2 approximately, which means that if you don't have control measures and you don't have any immunity in the population, each person who's infected rather, transmits on average to about 2 other people, and that leads to exponential growth, and that's what we've been observing throughout the world is a accelerating growth of the number of cases. So there are more new cases each day than there were the day before. And that means that we really are facing a problem that's big now, but is going to get bigger as time goes on. And one of the lessons from history is that early interventions in an epidemic like this are much more productive than late interventions. So if you intervene when you don't know you have a problem, then you might you will have a better handle on it than if you wait till you have a problem.
And that's why we've kind of seen different countries take a little bit different courses in how bad it's gotten overseas.
Yeah. So I think almost nobody outside of China has intervened very early on. Singapore and some parts of China. The places that have managed to control transmission to a reasonable extent. The places like Italy and other parts of Europe that are a little bit more behind in intervening to slow transmission, they've waited till the situation got bad. And the problem with that is that there's sort of a store of people who have become infected by that point, and it's a little late to stop the growth of demand on the healthcare system. And that's really what we're trying to do with advocating interventions to slow transmission.
Got it. So basically, on average, every one person who gets it will give it to 2 other people, and that is what makes it exponential. And you said it was like pandemic flu, and people have been saying that a lot. This is just like flu, but sometimes they say it in a way to kind of downplay it. Don't worry, it's just like flu, and flu comes around every winter. So, but that's not the type of
Right.
flu that you mean.
So pandemic flu is what happens when there's a new virus new type of flu to which people aren't immune. That happened most recently in 2009, and it happened 3 times in the 20th century, all of which were considerably worse than 2009. And the problem there is that it's easier to spread because nobody has immunity to it yet, and it's also typically more lethal for the same reason. And we're seeing that. So this is not flu. This is a pandemic of a coronavirus, a different type of virus. But the same kinds of considerations apply. That it's quite lethal especially to certain older age groups and to people with underlying medical conditions. And it's also spreading more effectively than, say, a seasonal virus would do. There are 4 seasonal coronaviruses that we get every year, and nobody's ever heard of them, but except for the people who study them. But they're there, and this is going to be maybe the 5th.
Got it. So in this time, kind of shifting to where we are in Massachusetts, we have started to take some measures, but you're saying that it affects different age groups differently. So particularly seniors and our elders need to take precautions because they're impacted differently than, say, young people or kids. What do we know about how widespread it actually is?
Well, we don't know much because for a whole number of reasons, legal reasons, technical reasons, and probably political reasons, it's been very slow to get testing out to the states and to hospitals, and even now in Massachusetts, the testing is mainly at the state lab and with limited capacity. So we just don't have enough testing to find out the extent of it. But there have been a number of cases in Massachusetts already. I've actually lost track of the numbers because I'm trying to keep up with too many things. But
they're growing every day.
They're growing every day, and that's a fraction of the actual numbers. We need more testing, really not because we want everybody who's sick and has a cold to go and get tested. That's not going to work. We're never going to be able to test that number of people. What we need is targeted testing by public health authorities so that we can get a handle on how many people are out there not by testing them all, but by testing a sample, and on whether that number is going up or going down, so we can calibrate our control measures.
And where the hotspots are, or is it basically at this point as widespread as it?
There will be hotspots because different communities will intervene more intensely or less intensely.
Okay. And so speaking of interventions, can you just describe what is the policy goal? I've seen a lot of graphs on Twitter and flattening them and this and that. What does that mean?
Right. So there is a Twitter hashtag flatten the curve. I've never seen an infectious disease epidemiology have so much play on Twitter. The idea is that if we have that epidemics follow a sort of bell-shaped curve, if we don't do anything about them, and if we apply the brakes through interventions, which we'll talk about in a second, that curve is shallower and longer and has less of a peak, and there are fewer people in it altogether.
And the peak means what? The number of people that are sick at any time?
The peak means the number of people sick at any given time. And the reason, so we want to flatten the curve, as the hashtag says, because first we want fewer people to get infected. That's a good thing, of course. Second, if people are infected, it's better if they get infected further out in time in the future, because we'll have hopefully better ways of dealing with the infection. And the third thing is that the height of the peak tells you how bad the stress is on the healthcare system. And what's been seen in different parts of China and now in northern Italy and elsewhere is that places that intervene really early, before they know that the healthcare system is under stress, before it's under stress, are able to control the infection and slow down the spread, and manage the impact on the healthcare system. Places that don't, like northern Italy and like Wuhan, China, where the epidemic started, both of which waited until there was a visible large problem to intervene, those places have had really, really big problems taking care of all the most critically ill patients. So in northern Italy right now, there are people that are their doctors having to choose which patients to let die because they simply don't have time and resources to treat all the patients.
So
that's
basically,
a bad situation.
If we can slow the amount of time that the one person that gets sick gives it to two people, then not everyone gets sick at the same time, and there's more chance that we have more beds available for people who most need it. So what do you say if people say, Boston is the global hub for quality healthcare, we have more beds, we'll be able to handle this, we can weather the storm?
Yeah, well, I don't know if we're much above the national average. We certainly have very high quality healthcare, but we don't have, but we also have a lot of people in the area, and so and a lot of people relying on tertiary care in Boston hospitals. So Milan, Italy is not very different from Boston. I heard at a Mass General grand rounds this morning the statement that Milan has the same kind of healthcare we have, and that's where people are being left to die because they just don't have time to take care of them. And doctors who are pathologists or orthopedists or something are being given a pamphlet and told, go take care of these pneumonia patients. It's really a serious situation, and what we want to avoid is replicating that here.
So it's people being turned away from COVID-19, but also that displacing every other type of bed that we have. Yeah. So we're trying to do everything to be as early in the intervention as possible, to plan for that peak being lowered and beds more likely being available. We have started to make some of those really hard decisions about canceling events like the St. Patrick's Day Parade, which you were a huge advocate for getting on top of that on the earlier end. And now we're talking, the marathon being postponed and other events. That has a tremendous cost, definitely, for all the businesses, all the people, the city's sort of social fabric. But we are looking at avoiding those life and death costs down the road. How do you think about, where we are now, which is we're kind of all getting on the same page in terms of big events, but then taking that one more step to not just the things that happen one time that are great and we miss them, but basic daily supports for families like kids being able to go to school, or the MBTA, which I ride every day. It's been as crowded as it's ever been. Yeah.
So, unfortunately, I think in order to slow things down we are going to have to take much more intensive action. the Biogen meeting that led to a reported 70 new infections from a medium-sized corporate meeting shows us that getting people in a room together in large numbers and at high density can really transmit the virus a lot. And this is what we want to avoid. So I think that I'm not going to make a recommendation right now because there's so many considerations about people's well-being, and I'm focused on the disease part, not the overall part. But from a disease control perspective, shutting down the T would in fact be a wise decision. Closing public venues like theaters and places where large numbers of people gather at a relatively high density and that are not very well ventilated. Those are serious considerations. All of this happened in 1918 when we had the flu, and the places that did it early escaped the worst of it, and the places that didn't do it early had very high peaks and larger numbers of people infected. So it sounds draconian, and it is draconian, and it's up to the leaders of the city and state to figure out how you balance that. But schools are another issue where we know that schools can be a place where this virus is transmitted potentially, but we don't know how much because we don't know what role children play in transmission. They tend to be very, very mildly affected if they're sick at all. And so those symptoms of coughing and sneezing that are part of transmission might not be so important. So closing schools is possibly the most costly thing we could do in terms of people's well-being for all sorts of reasons. And it's also the one that's a little bit uncertain about how effective it is. So that's the hardest decision in a sense. But the other ones, unfortunately, I think we're going to have to try if we're going to stem this tide.
And I want to flag also, I had heard from a few parents and others who wanted to note that there are young people also, their loved ones who are living with immune deficiencies or compromised immune systems, and so there are additional considerations. Even though a school population, for the most part, children might not be showing the symptoms, that we do have some families who are extremely worried right now, and we need to be coming up with the guidance, sort of at the policy framework level to make sure that we're thinking about all these different situations, particularly for our most vulnerable populations. I think about our residents experiencing homelessness also, and all the various ways in which some people might be able to, just suffer a little bit of inconvenience because then they'll just work from home and have to deal with the dogs in the house, bothering them. But others, there is a whole set of additional social structures that have to be put in place.
Yeah, and that's, mitigating the impacts of social distancing, as we call it, which is this whole set of interventions to slow things down, is just as important as doing the social distancing. So finding ways to make sure that those individuals who are at most risk of bad consequences from the social distancing itself, for example, children who get 2 of their meals a day in school, are not harmed. That is essential, and that's one reason why we need the health departments to be able to focus, and the education department in this case, to be able to focus on those issues.
To coordinate, so basically that we're not just shifting the impacts of this onto low-income residents of color, our most medically vulnerable population.
Yeah, exactly.
So in the meantime, all of us, I know all of my colleagues on the council and in the state legislature and elsewhere in government are trying to push for this coordination to happen transparently as quickly as possible. We do have a city council hearing scheduled for Monday and Tuesday of next week, which you are graciously sharing your time with as well. But in the meantime, before there's guidance about the T being shut down or schools, and people are still, for the most part, some expected to go to work, and maybe hourly workers that don't have that flexibility until there is a directive, how should individuals think about trying to keep themselves as safe as possible when they are in public spaces, because they have to be?
Yeah, it's a good question. So the simple things of washing hands for 20 seconds with hot water and soap, and doing it frequently, of staying away from people who are coughing, of staying away from, of staying home if you're sick. And for employers, that means making that possible and making sure that the that the hourly workers as well as the salaried workers are allowed to stay, and not just allowed but encouraged to stay home if they're sick. That's good sense for the employers, and it's good sense for the workers. So those kinds of things, and then I personally am able easily to work from home, and so I am, even though I don't have to. It's not a policy yet. Those who can, I think I would recommend it, and employers should encourage it. Our university, Harvard University, has now restricted any kind of gathering of people to less than 25 people, which is much smaller than I've heard New York City is thinking about restricting gatherings of 1,000, but 25 is a much smaller thing. So the things that transmit virus, that allow virus transmission, are touching each other and touching things that each other touches, like doorknobs, without washing hands. And then from the respiratory route, just hang up. From the respiratory route, transmission depends on high density of people and low humidity and low ventilation. So stuffy rooms are stuffy because there's not much air changeover, and that is an opportunity for virus transmission. Meeting your friends outdoors or in a well-ventilated place is a good idea. And some of these things are things that employers can do in workplaces, and some of the things are things we can do as individuals.
Got it. So how long is this new world order going to last? Are we talking about 2 more weeks of canceling events, or what would you predict?
I'm afraid it's going to be considerably longer than that. I hope I'm wrong, but my concern is that in 2 weeks we're going to be having really tight squeeze on the healthcare system. It's still going to be getting worse, even if we start social distancing now, because the healthcare impacts are several weeks in the future from the individual transmission events. So if we stopped transmission altogether today, we would still have growing demands on healthcare for several weeks. So it's going to look like the interventions aren't helping, and that's going to confuse people, but they will be helping if we do them intensely enough, and then we'll have to see. I think people will be scared enough by that they will start to social distance more on their own, and then we'll see where we are. But I think this disruption could be months.
With warmer weather, things might get better?
I think they will get modestly better, but I think the rate of increase of the virus will be slower, but I think it will still be increasing unless we have really tight restrictions in place.
Got it.
But that's also quite uncertain because we don't know about this virus yet. It's a new virus.
And what is the timeline looking like for a potential vaccine or some other way to inoculate people?
It's long. It's probably the shortest I've heard as a best case scenario is 1 year. Other people have said the best case scenario, actually the same authorities have said the best case scenario is 1.5 to 2 years.
Wow.
It's a long time, unfortunately, and that's an accelerated process, but it just takes time to make a vaccine and scale it up.
So at whatever point the kind of curve goes down, or we're able to think about lifting more of this social distancing recommendation, what then, right? Historically, how have economies recovered? How have small businesses come back? What should we be thinking about now in terms of that kind of mitigation?
Yeah, I mean, I think the only real historical precedent is 100 years ago in 1918, and this is a very different world. So I think it's the job of people in government and in the private sector to figure out ways to make that work better. I certainly don't have the answers to those questions.
I have a lot more dim sum then.
Yes.
Okay, and then in the long run, right, and now I'm talking maybe 2 or 5 years out, you're already in the profession of thinking about these as events that will come around.
Yeah.
So sometimes it feels like we're thinking about COVID-19 as something we just got to get through and take care of, but I read this book Spillover that from a while ago that brings a science basis to zoonotic disease, right? Illnesses that are transmitted from animals to humans that can then sweep across our society. And one of the pieces that stuck with me was that as the climate changes, as weather gets warmer, as humans start to encroach more and more on animal habitats, that this will become more frequent of an occurrence. Is that generally what you think?
I think that's probably right. I mean, we're not good at predicting very rare events like spillovers. There have been 3 coronavirus spillovers in the last 17 years. That's a lot.
Yeah.
That's all the ones we know about in history. There must have been others because we have other coronaviruses that circulate all year round. So spillover events happen, and I think those are good projections that it will get more common rather than less. So we need to prepare for these kinds of responses and sort of support the peacetime work, the in-between pandemic work that makes these kinds of responses possible. And that's in every sector. That's in the vaccine sector to prepare to make vaccines more rapidly and scale them up, and test them and scale them up. It's in the epidemiology sector. One of the tragedies is that our pandemic preparedness office in the White House and many of the federal efforts at pandemic preparedness have been cut during this administration. So that's not helpful, and we need to go in the other direction. So it's government, and in the private sector we need to learn the lessons of what works to control these epidemics and what can be scaled up quickly to make sure that, for example, there are good supplies of foods, medicines, personal protective equipment, all those kinds of things that are needed at any time, but especially in a pandemic.
To make the plans and then maybe even drill them from time to time just so we're ready. As we are trying to get through this one, it is, we're learning all these new terms and flattening curves and social distancing. I've been trying to emphasize that when we say social distancing, we're talking about physical distance between you and the people that you're having conversation with, but that we don't want to distance people from their social networks, in that now it might be more important than ever for people to be, not in your face, but picking up the phone or sending an email, check on your neighbors, check on your families. So those of us who are either taking care of family members or particularly our parents or generations above, what should we be telling them to think about? Stocking up on prescriptions or what else?
So there's ready.gov/pandemic has a good list of preparedness actions that everybody can take. I think what you say about keeping the social network intact is really important. Some of us have been more tired and stressed out than ever before in this time, and this will extend to others as people start to get sicker. So keeping the social network in place, and yes, using electronic means to keep in touch with people is going to be increasingly important. Also, the feeling of doing something helpful is a very empowering feeling. So for those who can, say, go grocery shopping for an elderly neighbor or relative, so that person is not exposed to other people, that's a really valuable thing. We will get through this. 1918 was, I think, worse than this, and certainly the medical system was worse. And to give some perspective, in 1918, we didn't know what a virus was, and we certainly didn't know that flu was a virus. So we've come a long way since then, and we are in better shape, and we got through 1918, and we'll get through this, but it's going to be painful, both the impact of the epidemic and the impact of the measures to try to control it.
And to get through it in a way that is equitable also in supporting those who are most vulnerable economically and medically. So the last thing that I want to say before wrapping up and thanking you so much is that we will continue this conversation. I know there were many other questions about different categories, so we'll try to keep the stream of information coming. If you are interested, you can tune in to the Boston City Council's hearing on the coronavirus. It will be 2 days. Monday, March 16th, starting at 5:30 p.m. We'll be opening with our expert, Professor Lipsitch here. And then Tuesday afternoon, starting at 2 p.m. on a slightly different set of topics. This will be sponsored by my colleagues, Councilors Matt O'Malley and Councilors Ed Flynn, and chaired by Councilor Ricardo Arroyo of the Public Health Committee. So there's a whole set of preparations going. We hope to get into a lot of detail about what city departments and agencies and other large-scale institutions are doing. Thank you so much, Professor, for your time.
Thank you.
I know we're not shaking. I don't know if you're bumping, but we'll stay in touch.
Thank you for having me on. Good.